originally I'm originally from Laredo, Texas, moved here to San Antonio for right after high school. So I have been a nurse for 15 years. Most of those years were as a pediatric nurse and a nurse educator. Uh, Approximately, it'll be 4 years in June when I joined this company, and it has been my pleasure to be able to assist patients with their daily healthcare needs. We'll go over and switch to our presentation. The main goal of teaching you about hyperlipidemia or high cholesterol is to help you keep your heart healthy. We want to make sure that you understand what this condition means and show you simple ways to manage it so that you can lower your chances of heart problems in the future. Hyperlipidemia is having high levels of lipids or fats such as cholesterol and triglycerides in the bloodstream. Your body needs some cholesterol, but too much of it can become harmful. Most people don't feel sick or notice any symptoms, which is why this condition is often called a silent problem. Unfortunately, in today's modern lifestyle, makes high cholesterol more common even in young adults. Not getting enough movement, eating convenience foods, and dealing with stress all raise cholesterol and triglyceride levels. Understanding these basics help you see why hyperlipidemia matters. Cholesterol is important because it helps your body make hormones, build healthy cells, and produce vitamins. Your liver already makes all the cholesterol you need. Now, the problem happens when cholesterol levels get too high, especially the LDL cholesterol or the bad cholesterol. This builds up inside your arteries and forms plaque, which narrows blood flow and raises your risk for heart attack and stroke. The HDL or the good cholesterol helps protect your heart by acting as a scavenger and removing excess cholesterol from blood vessels and carrying it to the liver to be broken down. HDL also offers anti-inflammatory, antioxidant, and anti-clotting benefits to protect cardiovascular health. Triglycerides are another type of fat that your body stores for energy, but they go up when you eat more calories than you need, especially from sugary foods and alcohol or overeating. Keeping these fats in healthy balance helps protect your heart and overall health. Your cholesterol numbers tell you a lot about your heart health. So your total cholesterol should be under 200 to stay in a healthy range. LDL, which is the bad cholesterol, ideally should be below 100, which helps protect your heart. And if you already have heart disease, your doctor may aim for below 70. HDL, which is the good cholesterol and helps keep your arteries clear, it is best having it between 60 and 80 milligrams per deciliter. Triglycerides are another kind of fat in your blood, and they should be below 150. When any of these numbers get too high, your risk of heart disease increases. Your doctor checks these levels with a blood test called a lipid panel. It's also important to talk with your healthcare provider about what your numbers mean for you because healthy levels can be based on your sex, your age, and personal risk factors. High cholesterol is dangerous because it can slow buildup inside your arteries, almost like clogging a pipe. And this buildup is called plaque, which makes it harder for blood to flow to your heart and to your brain. Now, when the heart doesn't get enough blood, it can lead to a heart attack. And when the brain doesn't get enough blood, it can cause a stroke. And the scary part is that the damage often happens quietly over time without any symptoms. Keeping your cholesterol at healthy levels helps keep your arteries open and lowers your risk for these serious problems. Hyperlipidemia or high cholesterol can happen for many different reasons. Some people are born with a genetic predisposition. meaning their body naturally makes more cholesterol, even if they live a healthy lifestyle. Your diet also plays a big role. Eating a lot of fried foods, red meats, full-fat dairy, sugary foods, or drinking too much alcohol can raise cholesterol and triglyceride levels. Physical inactivity is another major cause because not moving enough lowers your good cholesterol and makes it harder for your body to control fat levels in the blood. There are also additional risk factors like being overweight, smoking, stress, and medical conditions such as diabetes, which can all work together to raise your cholesterol. Excuse me. So even if you feel fine, these everyday habits and inherited factors can quietly contribute to high cholesterol over time. Your daily work routine can affect your cholesterol more than you might realize. Jobs that involve sitting for long hours slow down your metabolism and lower your healthy HDL cholesterol. On the other hand, standing all day can cause fatigue, which makes it harder to stay active after work. Work that requires heavy lifting can strain your body, especially if you don't have regular exercise to support your muscles and heart. Many people also deal with travel or long shifts or unpredictable schedules, which can lead to skipped meals, fast food choices, or eating at irregular times, all which can raise cholesterol and triglyceride levels. So over time, these work habits can quietly increase your risk for cholesterol and unless balanced with healthy daily routines. Physical activity is one of the most effective ways to improve high cholesterol and protect your heart. When you stay active, your body raises your good cholesterol or your HDL cholesterol, which helps clear extra cholesterol out of your bloodstream while helping lower your bad or your LDL cholesterol and triglycerides at the same time. Regular movement also supports weight control, improves blood sugar, and reduces stress, all of which again play a big role in keeping cholesterol levels healthy. Most people benefit from about 150 minutes of moderate activity each week, so 20 to 30 minutes a day approximately. And the good news is that it doesn't have to be intense workouts. Simple activities like walking, dancing, gardening, biking all count. Finding activities you enjoy makes it easier to stay active and improve your cholesterol and keep your heart strong over time. Now, physical activity also supports better mental health by reducing stress, boosting mood, and improving sleep, things that can indirectly help your cholesterol as well. Healthy eating plays a big role in lowering cholesterol, and it starts with building balanced meals that focus on fruits, vegetables, whole grains, lean proteins, and heart-healthy fats. Foods rich in antioxidants like colorful fruits and vegetables help protect your blood vessels, while fiber from whole grains, beans, and produce help your body digest food better and remove excess cholesterol. Choosing lean protein options such as poultry, fish, and legumes gives your body the nutrients it needs without the extra saturated fat in red or processed meats, including healthy fats like olive oil, avocados, nuts, seeds, and fatty fish such as salmon. Those all can help improve your cholesterol by supporting good HDL levels. So even small food swaps like choosing grilled instead of fried food or replacing white rice with quinoa can make meaningful differences in supporting your health. Oils high in saturated and trans fat, especially coconut oil, palm kernel oil, and hydrogenated vegetable oils, are bad for cholesterol as they significantly raise the LDL or the bad cholesterol. These fats are often found in processed foods and baked goods and clog arteries and increase the risk of heart disease. So instead of the previously mentioned, opt for oils rich in unsaturated fats such as olive oil or avocado oil, or even sunflower oil. Some foods that we intake can help lower your cholesterol and support a healthy heart. Foods high in soluble fiber like oats, barley, beans, lentils, apples, citrus fruits, carrots, broccoli, they help block cholesterol from entering your bloodstream. Nuts and seeds such as almonds, walnuts, and chia seeds are also heart healthy. Healthy fats from olive oil, canola oil, avocados, and fatty fish like salmon or tuna support good cholesterol levels. Soy products like tofu and edamame can help lower LDL or the bad cholesterol, and certain fortified foods with plant sterols or stanols can reduce cholesterol absorption. So try to include at least 5 to 10 grams of soluble fiber each day for best results. Drinking enough water and limiting alcohol can help you manage hyperlipidemia or high cholesterol. Staying hydrated helps your heart pump blood better and keeps your body working the way it should. Drinking too much alcohol can raise triglycerides and increase blood pressure and add extra calories, making cholesterol harder to control. Very heavy drinking can significantly raise cholesterol levels and increase your risk of heart disease. So if you have hyperlipidemia or high cholesterol or any other heart-related conditions, talk with your doctor about how much alcohol is safe for you. Normally, moderate would be 1 drink for women per day, and for men up to 2 drinks. Now, managing our weight with high cholesterol can be easier when we focus on simple daily habits. Eating more heart-healthy foods can help improve cholesterol levels and support weight control, while limiting foods high in saturated fat, sugar, and refined grains help prevent weight and keeps cholesterol in check. Again, staying active helps the most in raising the HDL cholesterol or the good cholesterol. And it also supports gradual weight loss. Watching portion sizes and eating slowly can reduce overeating, and limiting alcohol helps avoid those extra, what we call empty calories, and improves triglyceride control. Drinking enough water throughout the day also supports healthy digestion and can help reduce unnecessary snacking. Together, these small lifestyle changes can make a big difference in managing both weight and cholesterol levels. Smoking and stress can both make cholesterol problems worse. But the good news is that you can take simple steps to protect your heart. Smoking lowers your good cholesterol, your HDL cholesterol, and damages your blood vessels, which quickly raises your risk for heart disease. Quitting smoking helps your cholesterol levels improve and boost your heart health, often within just a few weeks. Stress can also throw off your cholesterol because it can lead to unhealthy eating, hormonal changes, and inflammation in the body. Using any stress management techniques like deep breathing, stretching, walking, mindfulness, and setting healthy boundaries can help calm your body and support better heart health. Making small changes in these areas can have a big impact on your overall well-being. Now, medications for cholesterol are very important. Statins are the most common medicines used to lower bad or LDL cholesterol and help protect your heart. Fibrates are used when triglycerides are very high and need that extra help to bring them down. Cholesterol absorption inhibitors work by helping your body take in less cholesterol from the food that you eat. Your primary care provider will choose the best medication for you based on your numbers and overall health. And these medicines work best when combined with healthy habits like good nutrition, exercise, and again, not smoking. Screening for high cholesterol is important because it helps find problems early, before they cause heart disease. Current guidelines recommend that adults get their cholesterol checked starting at age 20 and then every 4 to 6 years, with more frequent testing if they have risk factors like diabetes, high blood pressure, or a family history of heart disease. Staying on top of your numbers can lead to an improved quality of life because managing cholesterol early often prevents long-term complications. Screening also supports informed decision making, helping you and your healthcare provider choose the best steps for your health. And it can even lead to cost saving since preventing problems is usually cheaper than treating them later. Knowing your cholesterol levels brings peace of mind, and regular checkups allow for personalized healthcare with prevention plans and that are tailored to your needs. Together, these benefits make screening a simple but powerful tool for protecting your heart health. So, in closing, managing high cholesterol is all about taking small steps, steady steps toward a healthier life. By staying informed, getting regular screenings, eating well, and staying active, managing our stress, and using medications when needed, we can all greatly lower the risk of heart disease. Remember, every positive change, no matter how small you think it may be, helps to improve our long-term health. You're not alone in this journey, and your healthcare team is here to support you every step of the way. If you guys have any questions that I can answer.
Okay, so if you have any questions, you can post them in the chat or you can take yourself off of mute to ask the questions. No, ma'am. It doesn't look like we have any. So no, there won't be a written of this, but there will be a recording. So the recording will go out to everybody once it's available. Are there any other questions? Okay, so there were no other questions, and I think you touched on all of the other. Carmen, did you went over all the other questions that came through?
Yes, ma'am.
Okay.
I know that somebody had genetics, or can it be, is it hereditary? It certainly can, and that would be more of a familial hyperlipidemia. Um, that has special testing with your provider. That is also attached to information that Heather will share on the email. It goes more into depth.
Okay, perfect. And yeah, so there will be some PDF documents that Carmen sent over to me. So as soon as the recording is ready, I will send the link over for the recording as well as those PDF documents as too. All right. So if there are no other questions, I appreciate you guys joining us today. And again, our next one is on March 25th from 12 to 1 on kidney health, because it is Kidney Health Month. And again, we do appreciate you joining us today. Thank you.
Thank you.